Hello, my name's Alex Schadenberg, and I'm the Executive Director of the Euthanasia Prevention Coalition. And I want to talk about what's happening with assisted suicide in America and how we can prevent the spread of assisted suicide in America. The fact is that when we look at assisted suicide, the American Medical Association remains opposed to assisted suicide. They define assisted suicide as occurring when a physician facilitates a patient's death by providing them the necessary means and/or information to enable that patient to perform the life-ending act. So what assisted suicide is when the doctor or somebody else is directly involved prescribing the lethal means to cause death. Okay, so what happens is that doctor would then speak to that person, would then approve that person's death, would prescribe the lethal drugs. They're assisting in the suicide. And if you think about the definition, it actually fits because the person is dying by a suicide, and in this case, the physician would be assisting that act. The American Medical Association says it's understandable, though tragic, that some patients in extreme duress, such as those suffering from a terminal, painful, debilitating illness, may come to decide that death is preferable to life. However, allowing physicians to participate in assisted suicide would cause more harm than good. Physician-assisted suicide is fundamentally incompatible with the physician's role as healer and would be difficult, if not impossible, to control and would pose serious societal risk. And I think the American Medical Association has it correct. But what's happening right now? Well, assisted suicide has been legalized in the US in California, Colorado, Hawaii, Maine, New Jersey, Oregon, Vermont, Washington State, and the District of Columbia. So that's actually sadly been really growing over the last few years. It's also permitted in Montana, but it's not legal in Montana, but it was permitted by the Baxter Court decision, which created what they called a defense of consent, meaning that if the physician were prosecuted with assisting a suicide, the physician would have to prove that the patient consented. Assisted suicide bills are currently being debated right now in Arizona, Connecticut, Indiana, Iowa, Kansas, Kentucky, Massachusetts, Nevada, New Mexico, New York, North Dakota, and Rhode Island. And I'm sure there'll be a few more states that will be looking at debating assisted suicide in 2021. Last year alone, there was 20 assisted suicide bills that were debated. None of them passed, just so you know. Assisted suicide expansion bills are also being debated in California, Hawaii, and Washington State. Now, why is this important? Because not only are they debating the legalization of assisted suicide in quite a few states in the US right now, there's states that have legalized assisted suicide, such as California, Hawaii, and Washington State, which are now talking about how to expand their bills. The media wants you to think that there's a tidal wave of support for assisted suicide. Well, as I said, in 2020, there was 20 states that had assisted suicide bills and all were defeated. Now, I understand that it was a difficult year in 2020 for legislators with COVID, but even in 2017, there had been 26 assisted suicide bills debated that year and all were defeated. In the past few years, 4 states have strengthened their assisted suicide laws, and they include Idaho, Georgia, Louisiana, and Arizona. So obviously speaking, this is not a tidal wave in support of assisted suicide. On top of it, state and federal courts continue to maintain that there's no right to assisted suicide. Now, how do these laws work? And I think this is a fundamental question when we get down to how they work. So a lot of people think of this as an issue of my control, my body, my autonomy. And that's what's being sold to people. My body, my choice. And how do these assisted suicide laws work? Well, a person must request the lethal dose. So that's actually the only thing actually within the law, which is about the individual asking for death. Then the doctor must examine the person to determine if the person qualifies. So the first doctor is assessing whether or not that person qualifies under the law for assisted suicide. And if the first doctor approves and says, yes, you qualify for assisted suicide, a second doctor must ensure that the prognosis and the decision for assisted suicide is correct. So the second doctor does not necessarily, depending on the state, have to actually even visit or see the patient. They often will simply look through the patient records or somehow communicate with the patient and agree that yes, assisted suicide, death is the best answer for this person's condition. The person must pick up the lethal dose from the pharmacy, or the physician would then arrange for that. And once the lethal dose is obtained from the pharmacy, there's no further oversight of the law. It's very important how the law works. The law is designed to protect physicians It's not designed to protect vulnerable people. Because once the person dies, the physician who wrote the prescription must submit a report. And if you look at the data, though, from Oregon or Washington State, where it's been legal for the longest period of time, you'll notice that very few times is the doctor actually at the death. And yet the doctor who then approves the death, the doctor who writes the prescription, the doctor who then does all that, also is the doctor who sends in the report from the government. So it's what you call a self-reporting system, a system that's designed to protect the physician who's willing to be involved with assisted suicide. The approval and reporting system denies effective oversight of the law. The laws permit the same physician to approve assisted suicide, then prescribe assisted suicide, and the same physician is then required to report the assisted suicide. These self-reporting systems protect the physicians. They do not protect vulnerable people, and there is no effective oversight of the law. It's very important that we understand this. Traditional assisted suicide laws had a 15-day waiting period, but these laws are now also being amended. So now we have several bills that are trying to amend these laws, such as California, Hawaii, Washington State, and one already passed in Oregon that amend these laws that there not be a 15-day waiting period. But on top of it, that these waiting periods can be waived. So therefore, it's possible to have a same-day death. So we're really talking about a situation that's really moving quickly then to have more assisted suicide in the US. But let's look at the data a bit first before we get into the further issues on this issue of assisted suicide. And I'm going to look at both Oregon and Washington State, because both of these states have had assisted suicide for a fair amount of time, and then you're able to see the data better. In 2019, the Oregon Assisted Suicide Report said there have been 290 lethal prescriptions that were written and 188 reported assisted deaths, which was up from 178. Now you would say, well, wait a second, that means 102 people did not die by assisted suicide who were given prescriptions. But you have to understand that there would be quite a few people who in, let's say, October, November, December had received their lethal doses, but had not taken it yet because they say, we're not yet near to death. So you have that reality with all of these things. When you look at the data, 62 people who received a lethal prescription died from other causes, okay? That should not confuse anybody. A lot of these people actually are nearing death, they have terminal conditions, and it's not uncommon for someone to die in their sleep. But in 2019, it's very interesting if you look at the data, there was 21 deaths. So the state of Oregon knew these people had died, but they have no idea how they died. So you see that in the assisted suicide report, there was 21 people who died who had received the lethal prescription, but they have no idea how they died. They don't know if it was assisted suicide, a natural death, they have no idea. And in 2018, there were 14 people in the same circumstance. So that means in 2 years, 2018 and 2019 in Oregon, 35 people died who had received lethal prescriptions, but the state has no idea how they died. These deaths, where the ingestion status is unknown, might be unreported assisted suicides. It's very possible. We don't know. The time of death ranged from 1 minute to 47 hours in 2019. One patient was referred for a psychological or psychiatric evaluation, only one person. So out of the 290 lethal prescriptions that were written, one person was referred for a psychological or psychiatric evaluation. Let's think this through. Are they saying that there was not more than one out of 290 who were experiencing such emotional angst, such depression from their medical condition? It could be just related to the medical condition, possibly. None of them? Only one person needed to be referred for a psychological or psychiatric evaluation? That seems a bit ridiculous, I think. One physician was referred to the Oregon Medical Board for failure to comply with the law in 2019. Washington State Assisted Suicide Report indicates that there was 25% more assisted suicides in 2018 than 2017. Now, what's important is we don't have the 2019 report yet from Washington State. The 2018 report said that there have been 203 reported assisted deaths, which was up from 164. 267 lethal prescriptions dispensed, which was up from 212. Growth, more deaths. 29 no natural deaths. That means people died a natural death rather than dying by assisted suicide. They said 16 of the death status was pending, meaning 16 of the people who had received assisted suicide drugs, lethal drugs, had not died yet in 2018. 19 deaths where the ingestion status was unknown. 19 people who died, who had received lethal drugs, and they have no idea how they died. And if you look at the report, once again, it says when the status is unknown, it means they have no idea. They just simply don't know. It could be, as I say, it could be possibly an unreported assisted suicide death. There were more complications in Washington State in 2018, likely related to the new human lethal drug experiments. Now, what's very important here is there's a group of assisted suicide doctors who got together a few years ago and decided they wanted to find a cheaper way to kill, a cheaper, effective way to kill. So they started what they called this whole group of doctors who were started on experimenting with different types of drug cocktails that they knew would be lethal. They just didn't know how it would work. The report states that 8 people reportedly experienced complications, which was up from 4 in 2017. But also 62 of the people who died by assisted suicide in 2018 died more than 90 minutes after taking the lethal drugs, and the range of time from death was 7 minutes to 30 hours. I don't know how it accomplished it in 7 minutes. It's possible that the person fell asleep in 7 minutes, but to die in 7 minutes from these drugs seems a bit odd, actually. And this is what you need to know. The lethal drug cocktails that were developed to find a lower cost alternative for assisted suicide drugs are known to have caused significant side effects. The Seattle Times reported in March 2017 that the first Seconal was the drug that was being used traditionally, the first Seconal alternative turned out to be too harsh, burning patients' mouths and throats, causing some to scream in pain. Remember, this is supposed to be a death with dignity. The second drug mix has led to deaths that stretched out hours, and in some patients up to 31 hours in one case. Now, that was in Washington State, 31 hours. Remember, Oregon had one of those 47 hours. An article published in The Atlantic in January 2019 said an advocacy organization called End of Life Washington briefly advised prescribing a drug mixture with the sedative chloral hydrate. And this was done to about 70 patients. Robert Wood, the medical director of the organization, said he told his patients, "We know this is going to put you to sleep, and we're pretty sure it's going to kill you." And it worked. But the tragic catch was, in a few cases, the chloral hydrate burned people's throats, causing them severe pain just at the time that they expected relief. Now remember, they didn't just do this to 1 or 2 patients and said, "Oh, this isn't working well." They use this on about 70 patients. So at a certain point of people screaming out of this life from the chloral hydrate, you would think they would have stopped it and said, this isn't working well. I thought this was about death with dignity. No, really, I think it's about killing people. The Medical Express reported on September 8, 2020, a little known secret not publicized by the advocates of aid in dying was that while most deaths were speedy, others were very slow. Some patients lingered for 6 or 9 hours, a few more than 3 days. As I pointed out, the one in Oregon was 47 hours. Assisted suicide is obviously not what it appears to be. Many people support assisted suicide on the basis that they have a fear of dying a bad death. And assisted suicide, though, can cause a bad death. The assisted suicide promoters and practitioners, they developed these lethal drug cocktails by doing human trials rather than animal trials. It's an important point. The team appeared concerned with the lethal efficacy and the cost of the lethal cocktail as opposed to the possible negative consequences with the use of these drugs. Were these human trials done with the full consent of the participants? This is a very important point. We know that the participants agreed to die by assisted suicide. What we don't know is if they agreed to be part of human drug trials. Now, I'm going to say one more thing about that. There are rules for experimentation. They called the Nuremberg Code. The Nuremberg Code was put together after the Second World War because of the horrific research that was done by Nazis in Germany, etc., on people such as in death camps, etc. And the Nuremberg Code said that you could not do trials that caused death. That was the one thing. Secondly, it said you can't do trials without full consent. And I'm suggesting they don't have full consent for these assisted suicide drug trials. There are two types of assisted suicide bills that are being debated right now in the U.S. Several states have these traditional Oregon-style assisted suicide bills, so they're a little bit tighter than other bills than the other group of bills. Clearly, these bills are written in a tighter manner with the hope of passing the bill and then expanding the law in the future. Now, let me give you an example. Hawaii had assisted suicide bills year after year after year after year, and they were always defeated. Every single one of those bills were defeated or put aside because they felt that either A, it wasn't safe, or B, there was problems with the language of the bill. And this went on for quite a few years. And then in 2018, Hawaii passed their assisted suicide bill, and it became in effect on January 1st, 2019. So it was actually a tightly written bill in a sense of compared to these other laws that they're trying to use for expanding assisted suicide. Well, Hawaii this year is debating the expansion of assisted suicide. So obviously they needed a tight bill to get the bill through the legislature, and now they have a wider proposal to allow more people to have assisted suicide, and that's part of the game plan. Other states, such as New Mexico, have wider assisted suicide bills that allow non-doctors to prescribe or approve assisted suicide. They allow shorter waiting periods. In the case of New Mexico, it's a 48-hour waiting period. And then it says, but the waiting period can be waived, same-day death, if they believe that someone's actually nearing death. And also these bills, some of these bills trample on conscience rights. For instance, the New Mexico bill requires a physician who opposes assisted suicide to refer to a physician who's willing to do the act, or to a medical practitioner willing to do the act. Fighting assisted suicide. Well, we need to call it what it is. If we use terms such as aid in dying, physician-assisted death, doctor-prescribed death, all these other terms, they don't help us. The other side uses those other terms because people are uncomfortable with the term suicide. But assisted suicide is what it is. It's assisting a suicide. Now they would say, well, it's not like a normal suicide. Well, that's not necessarily true, okay? A suicide is actually defined as someone causing their own death. And in fact, assisting a suicide means you're providing the means for someone to cause their own death. So obviously, assisted suicide is the proper definition. We oppose assisting a suicide because these laws allow one person to be directly involved with causing the death of another person. I don't think it's ever a good idea to create exceptions in the law to who can kill who within a law, or who can be involved with killing another person. The term aid in dying is also used, this is for your information, for both euthanasia and assisted suicide. So you might notice in the US that the assisted suicide lobby has been using the term aid in dying. You have to understand that this is part of their expansion mode, that if the term aid in dying becomes acceptable, then they can invisibly, or very, how would you say, easily change the law to allow euthanasia in the future. The difference between euthanasia and assisted suicide is euthanasia is lethal injection. Assisted suicide is providing those same drugs that the person takes themselves. So in the case of euthanasia, the physician or a nurse practitioner, whoever it is, would lethally inject them, whereas in assisted suicide, it's the same drugs, but you take it yourself. So you can see the difference is not in the act of what it is, it's how it's done. We need to talk about what it is. The other side claims that this is a death with dignity. They talk about these deaths as being peaceful, quick, painless. You know, all of us want to avoid suffering. I don't know of a human being on this earth who doesn't want suffering. We know that many of these deaths, though, are not peaceful, they're not quick, and they're not painless. In fact, the assisted suicide experimentation that they've been doing has led to long, drawn-out deaths, which are often painful. Now, we believe in caring for people and not killing them. All these concerns around a bad death, well, these things can be dealt with by a caring culture. Talk about the lethal drug experiments. I think it's very important to talk about these lethal drug experiments because these have not led to dignified, quick, or peaceful deaths. These human experiments were inappropriate, unethical, and they caused people to suffer. The Nuremberg Ethics Code clearly prohibits human experimentation without proper consent and clearly prohibits human experiments that cause death. I think this human experimentation that's being done by the assisted suicide lobby fails on both counts. They had consent to prescribe lethal drugs, but did they have consent to human experimentation? You need to work with people from all political points of view. There's not one silver bullet to prevent the passage of euthanasia or assisted suicide bills. You need to work with people from different points of view. People with disability have personal experience. People with disabilities have a lived experience that needs to be heard by politicians. We need to encourage people to work together, but never discourage people from working on their own. I say this because, I've been involved with certain coalitions in the past, and they'll say, well, we can't work with so-and-so. And my response will be, well, you may not agree with so-and-so, but every perspective is important at the table when you're trying to oppose assisted suicide. That doesn't mean that that becomes the primary perspective, or it's the, we don't want to discourage people who oppose assisted suicide. We want to encourage people, actually, though, and encourage them to work together as much as possible. Don't focus on palliative care. I'm not saying palliative care is not important. I'm not saying palliative care isn't a blessing to people as they're dying, that they can have a peaceful death to proper pain and symptom management. But the problem is that assisted suicide advocates, they also support palliative care. They just don't have a problem with assisting a suicide. They don't have a problem being involved with causing death, but they support palliative care. So if you're saying, well, we need more palliative care, they would say, yes, I agree, we need more palliative care, but we also believe we need assisted suicide. If you also focus on palliative care, the other side will come back and say, well, there is the odd time, the very few cases where palliative care did not work and the person still suffered. Therefore, we need assisted suicide. So by focusing on palliative care, you create the difficulty that there is the odd time where someone did still have a bad death. And it's true in our human experience, but we would say that the care might not have been proper or to the fullest extent necessary. Nonetheless, the point is, it doesn't necessarily negate the assisted suicide argument. We believe it's wrong to be involved with killing somebody, that is always wrong. Focus on palliative care also causes us to focus on pain. Why do we need palliative care? Well, we want to alleviate pain and symptoms. Well, they're saying, we're afraid of that pain. We're afraid of those symptoms. We'd rather be dead. So even though palliative care can be excellent, the fact is that we do not want to focus on palliative care. It is something that should be done in society, that should be available in society, but it's not necessarily something that we use to fight assisted suicide. Don't hesitate to talk about the changes in the law in Canada. Now, you might have to watch one of my videos to understand that better, but Canada legalized euthanasia and assisted suicide in June of 2016. In February of 2020, so it's less than 4 years after legalizing euthanasia in Canada, the Canadian government introduced Bill C-7 that expands the euthanasia law by eliminating the requirement that a person be terminally ill. It eliminates the 10-day waiting period. It allows people to die by euthanasia for psychological suffering. It also allows someone who is incompetent to die by euthanasia if they had been previously approved by the doctor, etc. So the fact of it is this is less than 4 years after legalizing, and you have already this massive expansion of euthanasia in Canada. Now, if you don't want to talk about Canada, talk about Hawaii. Hawaii went through years of debate on assisted suicide, and every year defeated it, and then in 2018 passed it. So it came into place on January 1st, 2019, and now it's 2021, and there's a bill to expand it. Like the Netherlands and Belgium, Canada is talking about expanding euthanasia for children, for incompetent people who made an advanced request, for people with Alzheimer's and dementia, and for people with mental illness. You might have heard that the Dutch health minister announced in October of 2020 that the Netherlands intends to expand euthanasia to children. In November 2020, Canada's Justice Minister told the Senate committee that he wanted to expand euthanasia to include people with mental illness. So once you legalize it, once you've crossed the line, said it's okay to kill, the question now is, who can we kill and under what rules? That's the question. So the only way you can actually stop the expansion of assisted suicide is by making sure it was never legalized in the first place. Thank you very much. If you want to contact me, I'm Alex Schadenberg. I'm the Executive Director of the Euthanasia Prevention Coalition. My information is on the screen for you. And the fact of it is that we all need to work together to recognize that euthanasia, assisted suicide, in the case of US assisted suicide, this is what causes death. It's not about a peaceful death. It's not about, it's not about my body, my choice. It's the lie they give to us. This is about allowing the right and law for a group of people, in this case, physicians or medical professionals, to be involved in causing people's death. And it's always a threat to all of us as human beings. Thank you very much. You can contact me anytime at info@epcc.ca. Thank you very much.